This is the first MRI, and we can see again there is soft tissue edema at this location. We see bone marrow edema at the talar neck. There was no acute injury, but we don't really see anything wrong in terms of the bone. We don't see a bony defect. Maybe there's a little bit of a bump here. This is hard to see, and also the T1 will not really show us lots of things here. We see maybe just a tiny bit of thickening of the cortical bone, but we don't see an obvious nidus. So a patient then comes for a CT at some point a couple of months later, and then you can actually see a little defect, a little nidus here surrounded by bone formation or periosteal bone formation here, and it's so much easier to see on the coronal. So we go to the talar neck here and you can see the nice lovely nidus here. So this is the nidus here sitting right on top, a lytic zone with a central sclerotic component here, and we see surrounding bone formation, and this would be the original shape of the bone, right? So this is just a surface type of osteoid osteoma with surrounding new bone formation, and because it's quite close to the joint or even inside the joint capsule or at the attachment and parosteal, it doesn't really make this dense sclerotic osteoid components that we see in like the diaphysis of bone. So the axial also nicely shows this. It's very nice to see here. You can see this is the osteoid osteoma here, very nicely to see. And then they repeated the MRI. I think they were still not believing it, or I don't know, until Emmanuel saw it, and now I think this is the nidus. This is where the bone marrow edema is centered around. This is where the soft tissue is centered around. This is quite a classical case of osteoid osteoma. I've seen one case myself. I've seen a couple of them in the virtual MSK fellowship, and only recently Roar Pedersen, another MSK radiologist, published a case like this here on LinkedIn and also on his Instagram account, where you can see this looks exactly the same. Soft tissue edema anterior of the ankle joint, bone marrow edema here, so you might be thinking of anterior ankle impingement, but the edema is kind of like out of touch, and then you can see some bony irregularities, and in cases like this, CT will give you the answer and you can see actually the nidus. So this is a very nice example of how things can look quite typical. You need to see this once and you will never forget now.